Zimbabwe has been urged to urgently consider mobilizing domestic resources for a sustainable HIV response in the face of dwindling donor funds. This comes as one of the country's major HIV funders, the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, notified it will terminate funding for condoms in the next 30 months. Addressing journalists during a Health Communicators Forum Cafe on Thursday, a lobby group advocating for quality and affordable health service Campus noted that condoms are a critical prevention pillar that needs to be sustained beyond donor funding. We get more in the following report.
Zimbabwe over the years has made significant HIV gains, boasting of a successful antiretroviral therapy program. Other prevention mechanisms such as condoms have also been attributed to the gains. The big question is how sustainable is Zimbabwe's HIV programming beyond donor funding?
I think it's important to acknowledge the gains that we've made in the HIV response. But unfortunately, a lot of these gains have been donor supported. And this is why now we are ranking under the challenge of no funding for condoms in this country beyond 2025. And I think the clarion call is for number one, government to reconsider the budget allocation to health. As we speak now, it's at 11%, far short of the 15% Abuja, and also the 58% per capita spending that we are seeing.
Amid reports of looming condom shortages, experts insist the government should scrap value-added tax and import duty on condoms.
To also consider allowing private companies that are bringing in condoms to do so, and removing without duty and removing VAT on those condoms. And again, to make sure that we have a sustained response that is community-based. Let's go back to the strategies that we used at the beginning, your abstinence, your being faithful, and again the condom issue comes back in. But the call is to make sure that we have a response that is community-based and user-centered. This means that we need to refer to community structures, individuals and families to make sure that we have a sustained response.
The advocacy group noted Zimbabwe should adopt a community-centered approach in its HIV response, more than a donor-driven programming. In the face of advanced HIV disease, the country has been urged to resort to its CD4 cell count testing. CD4 cell count is an indicator of immune function in patients living with HIV.
Yes, you recall that at the beginning of our response, people were supposed to take a CD4 test. But at the onset of the viral load program, we then abandoned the CD4. But now we're beginning to see very high cases of advanced HIV disease, which require CD4 tests to make sure that we can do proper surveillance. And this again is the challenge, where we embraced a new strategy at the expense of one that was serving a purpose. So now we need to start again, going back to find investment for the CD4 machines. It's something again that we need to look into and see how best we can then bridge the gap that now exists between people who are on ART, who are living positively, and those that are transitioning to AHD.
The country faces a mammoth task to mobilize domestic resources and cannot afford to ignore the signs of donor fatigue. For ZTN Prime, I am Mirirai Nsingo.
Thank you, Mirirai, for giving us that report. We now have health journalist Michael Gwasira on standby to discuss this subject further. Good evening, Michael, and good to have you on News Plus. Now, what could be the overall impact of reduced donor funding in Zimbabwe?
Well, thank you. So, reduced donor funding to the healthcare sector, especially the HIV response in Zimbabwe, comes with costs. Because as it stands right now, majority of funding for our HIV programs are coming from donors. I would say maybe about 95% is coming from donors. When you look at the issue of procurement of antiretroviral therapies, condom programming, you look at other programs that are related to the HIV and AIDS response. So I think it's going to come with a huge impact, and it's going to come with a huge blow. And as it stands right now, PEPFAR announced that it will be cutting funding, not just for Zimbabwe, but for a number of African countries where the HIV burden has been quite huge over the years. So it's going to come with with the negative implications that need to be addressed on a domestic scale.
Perhaps as follow-up to that, what danger do those on antiretroviral therapy face if the gap is not closed?
Yeah, you find that in Zimbabwe locally we have our we have the native, or they call it now the AIDS levy, that we have locally, that we've managed to mobilize over the years. But as you can see, it's still very, very little. The contributions are still very little, and in the absence of donors, the money that we are getting from the AIDS levy cannot do much to actually, to turn the tide when it comes to AIDS. We are glad that right now we have achieved the 95 targets, but I think there's still need for support for some of the programs, so that at least we actually end AIDS by 2030, because we are now just a few years away from 2030, and if we are to reduce funding for these programs before the 2030 mark, we might regress and start experiencing challenges that we used to experience before HIV interventions such as ART and other programs came into play.
Now, before I let you go, Michael, the issue of the looming condom shortage is very much concerning. What could be the immediate solution at this point?
Okay, so looking at the issue of condom funding, so there are options that we can explore. Number one is to increase domestic financing. To increase domestic financing for the healthcare sector. If we attain the 15% Abuja target, I think it might go a long way in alleviating some of the challenges that we might likely face in the absence of donors. So we need to actually mobilize resources on a domestic scale to cover the gap that the donors are going to leave, because when the donors leave, as it stands right now, majority of public sector condoms that are being used in Zimbabwe are being funded by Global Fund and PEPFAR, and after 2026 they indicated that they will be ceasing or stopping any funding towards the condom program. So we really need to mobilize resources on a domestic scale, advocate for an increase in the budget towards the healthcare sector. That way we might actually we might actually address some of the challenges that we envisage.
Konapo, ipapo pa ZTN Prime, DSTV channel 294, the place to be.